Bone circulation diseases. Published by WordPress.com. AVN of the hip. Epidemiology. Commonly affects individuals aged 30 to 50 years. Bilateral involvement in 80% of cases. Anatomy. Blood supply of the femoral head is primarily through the ascending cervical arteries, which form extracapsular and intracapsular arterial rings, and include important epiphyseal arteries. Pathological stages. 1. Infarction, intact cartilage. 2. Sclerosis, new bone formation surrounding necrotic trabeculae. 3. Subchondral collapse, crescent sign and fragmentation. And 4. Joint arthritis, due to necrotic segment fragmentation. Steinberg staging, based on X-ray and histologic findings. Stage 0 normal imaging, histological changes only. Stage 1, normal X-ray, shows edema or ischemic changes. Stage 2, sclerosis, cystic changes, but no subchondral collapse. Stage 3, crescent sign, subchondral fracture, no femoral head collapse. Stage 4, femoral head collapse without joint space narrowing. Stage 5, femoral head collapse with joint space narrowing, acetabular changes. Stage 6, advanced arthritis, joint destruction. Shimizu staging, MRI-based staging. Stage 1 edema without clear demarcation. Stage 2 geographic low signal area, necrosis zone, no collapse. Stage 3 subchondral fracture, crescent sign. Stage 4 femoral head collapse, joint space narrowing. FICAT and Arlett staging. Stage 1, preclinical stage. X-ray, normal. MRI, bone scan, bone marrow edema, early ischemic changes. Symptoms: mild pain, possible limited hip motion. Management: conservative treatment, NSAIDs, bisphosphonates, core decompression may be considered. Stage 2, pre-collapse stage. X-ray, sclerosis, cystic changes, osteopenia, but no subchondral collapse. MRI, clear demarcation of necrotic area. Symptoms: progressive pain, stiffness. Management: core decompression, bone grafting, possible regenerative therapy. Stage 3, collapse stage, crescent sign present. X-ray, subchondral fracture, crescent sign, femoral head collapse without joint space narrowing. MRI, increased signal changes, evident structural compromise. Symptoms: significant pain, reduced hip mobility. Management: osteotomies, joint preserving procedures, possible early arthroplasty consideration. Stage 4, advanced stage, osteoarthritis. X-ray, femoral head flattening, joint space narrowing, acetabular changes. MRI, full joint degeneration. Symptoms: severe pain, restricted movement, possible limb shortening. Management: total hip arthroplasty, DA. Clinical presentation: hip pain, groin, insidious onset, worsens with activity, later at rest and night pain. Limitation of motion, flexion deformity, and antalgic gait. Imaging: X-ray, AP, frog lateral, shows FICAT staging. MRI, high sensitivity and specificity, with double line sign. Bone scan, high sensitivity in precollapse stages. AVN treatment: conservative, weight-bearing restriction, bisphosphonates for collapse prevention. Operative, core decompression, vascularized grafts, electrical stimulation, trapdoor procedures. Total hip arthroplasty, DA, for advanced stages.